Hello everyone. So this is Dr. Hub, your e-doctor. In case you haven't subscribed, please do subscribe for updates. Now in this video, we'll be looking at the vitamin A deficiencies. So it's a very important and high yield topic. So under this vitamin A deficiency, firstly we need to know the WHO classification of the vitamin A deficiency, that is the Xeropthalmia. So here Zn stands for night blindness, 1A is for conjunctival xerosis, 1B is for Bitot spots, 2 is for corneal xerosis, and 3A is for the corneal ulceration, and this is less than 1/3 of the layer involved. Now just to recap and easy memorization, you have a N and a N, that is N stands for night blindness and B for Bitot spots. Next, moving on, we have 1 and 2. So 1A is conjunctival xerosis and say 2 is corneal xerosis. So now moving further, we have 3B. Here it is corneal ulceration as well, and this is above 1/3 of the layers involved. And XS is for corneal scar, and F stands for the fundus, so xerophthalmic fundus. So here 3 stands for 3. So in case of 3 is there, you need to know that corneal ulceration is there, and F stands for fundus and S stands for scar. Now looking at XN, that is the pathological manifestations. So in case of XN, there is lack of rhodopsin. X1A, there is loss of goblet cells, and 1B, there is conjunctival keratinization that is seen. And next, in case of X2, we have the epithelial changes taking place and disorientation of the epithelium. And 3A, there is corneal stroma, liquefaction. Next, moving on to XS, there is not much of characteristic, whereas the XF, we have the retinal pigment degeneration that is seen. Now moving further, let's just recap. So we just discussed XN, 1A, 1B, 2, 3A and F. Now moving ahead, we are looking at what is sign. Not to be confused, sign is what the doctor sees and elicits, whereas symptoms is what the patient complains. This is the basic. So now just looking at the first sign, that is, and symptoms that are seen. So looking at the sign, the first sign that is to be found is the conjunctival xerosis, and the first symptom that is seen is nothing but the nyctalopia. This is the first symptom that is seen. Now looking at another pathological important feature that should be known, it is Bitot spots. Now looking at the treatment, we obviously need a vitamin A replacement. In that case, we need 200 international units of retinol palmitate that should be administered in 2 successive days. Next, we also have in case of corneal ulceration, we need to be giving children vitamin A just as a precautionary measure. And if in case of xerophthalmia early stages, by doing such practice, we can be able to prevent it. Now looking at the summary, we spoke about the WHO classification, that is from XN to XF. Next, we also spoke about the pathophysiology of each stage that is involved. Next, we spoke about the signs and symptoms. Next, we also spoke about the significant pathological findings, that is the Bitot spots. And then finally, we spoke about the treatment aspect, that is, here we had given vitamin A supplements in the form of retinol palmitate. Thank you. Please do subscribe. Any doubts or suggestions, please put it in the comment section, and do give a thumbs up or thumbs down in case you like or dislike the video. Thank you. Have a great day.